How many people are affected? Well, these numbers are staggering, and in the latest data compiled by one of the most well-known academic allergy groups, the AAAAI, which you can see the web resource at the bottom, allergic rhinitis is estimated to affect approximately 60 million people in the United States, and its prevalence is increasing. It does seem like every year more and more people and children are affected. Interestingly, according to some of the latest data, about 10 to 30% of all adults have allergic rhinitis, and as many as 40% of children. Some of the difference in these data numbers may be due to the way the studies are done, but it does appear that more and more children are affected. And I'm going to spend a minute and a little bit talking about food allergies, because there's just been some media story about whether or not we're overestimating food allergies. I'll address that. But it is clear that all allergic disorders are on the increase. From 2000 to 2005, the cost of treating allergic rhinitis almost doubled, from a staggering $6 billion to $11+ billion. More than half of that was spent on treatment with prescription medications. And I'm not here to say that all prescription medicines are wrong to use or inappropriate, but the cost spent and the safety and efficacy issues are really ripe for research and question, and I believe that if we focus more on prevention than treatment, we can treat people more effectively and save a lot of money. So as I said, I strongly believe that prevention is preferable to treatment, and that is true not only in allergic disorders, but all healthcare conditions, whenever possible. It is almost always safer, it is usually more effective and less expensive. And at a time where our healthcare system is really more of a disease care system, and we're really spending time and money trying to figure out how can we better take care of people and how can we do it more effectively and at a lower cost, you know, it's very clear that our current healthcare system does not incentivize preventive or wellness care. And this is something that I know I'm probably preaching to the converted here on this call, but we really need to work in our communities to develop systems that do prioritize prevention and wellness. We have to shift our values towards wellness care if we are to improve health. So I spent some time discussing integrative medicine in the introduction, and that's what I practice. In terms of definitions, integrative medicine takes conventional medicine and with it integrates what we believe are safe and effective, complementary, and alternative medical remedies. Sometimes these remedies are complementary, meaning they're used in conjunction with conventional medicines, and sometimes they're used in opposition to or as opposed to conventional medicines. Studies do demonstrate that the use of these CAM therapies is increasing among children and adults, and that for some conditions in chronic disorders such as allergies and asthma, the use of CAM therapies may be 70 to 80% in some populations. Families do sometimes substitute these CAM therapies for conventional care, but much more oftenly they're used concurrently. This is called integrative medicine, and it really is a rising field of medicine that both for adults and children, we are really devoting a lot of effort to research and to help meet the needs of the families we take care of. Unfortunately, many people, and this has been shown in study after study, many people do not tell their doctors about the use of these therapies. And one of the things I like to highlight in my practice, and this is something, again, we teach to pediatricians at the AAP and other groups that we meet with and all healthcare practitioners, is please be open-minded. We encourage our patients to talk with your doctor about all of the therapies and remedies your child is using. This is a poster you can actually download from the internet at the AAP site and others. I use it in all of my talks. And it has pictures on it that we have in our office so that families feel more comfortable if they are seeing a chiropractor, using acupuncture, special vitamins, massage therapy, homeopathy, herbals, mind-body medicine, and so on. They feel a little more comfortable bringing this up because it's there in the office, and it certainly gives them the appropriate impression that we are open-minded to this. So one of the challenges is finding healthcare practitioner that will work with you, but fortunately we do believe we're training more and more. So let's turn to really the meat of the talk, which is about natural remedies for allergy symptoms. I'm going to spend a fair amount of time on these various therapies, including nutritional therapies, botanical or herbal medical therapies, traditional Chinese medicine remedies, which do include acupuncture as well as herbal medicine. And I apologize if the slides jump ahead. It's on a timer, so I'll jump back, so just bear with me. Homeopathy, which is its own field of medicine some of you may be familiar with. Manipulative therapies, which are very popular in this country, including chiropractic, osteopathic, and massage-based medical therapies. Even hospitals now are integrating many of these therapies. And mind-body therapies, which include meditation, yoga, hypnosis, and many others. Some people would even include prayer in this category, and there are many therapies that we can work with young children, including guided imagery. And there are assorted others that we'll address at the very end.